Hello, welcome to the new episode of the podcast Let's Talk. Today we're going to be talking a little bit about anxiety. Joining us is Natalie Rios, a clinical psychologist and expert on the subject. Welcome, Natalie. How are you?
Very well, thank you, Leah. How are you?
Very well, thank you. To begin the podcast and provide some context, I'd like to start by discussing what anxiety is. How would you explain that concept?
Okay, Leah. I think what's important or the key point is that we can recognize anxiety as part of a range of emotions, right? The anxiety comes from fear, which is a natural emotion experienced by all human beings and helps us a lot, right? To prepare ourselves for dangerous situations. The anxiety essentially fulfills the role because it helps our bodies prepare for potential dangers and threats so that we can survive, right? So therefore, it's crucial to remove that taboo that we have. The anxiety is bad,
Yes,
right?
yes.
It's not bad. In fact, at a moderate and appropriate level, it's healthy because it helps us, it aids us to survive, as I mentioned earlier, okay? When is anxiety no longer healthy? When the intensity levels are just too high and too frequent, right? I mean, when anxiety stays with you for 6 days a week, right? Of the 7 days of the week, 6 days you had these episodes of anxiety and they are very high. That's when we're likely dealing with an anxiety issue when it transitions into a pathological fear.
Of course. Now that you mention it about how anxiety can become a problem, I was thinking about the different symptoms we might experience when we're going through it. So I know that anxiety, as I mentioned, includes physical, psychological, and behavioral symptoms. How would you explain how we can identify the symptoms? When can we determine that a symptom is related to anxiety?
Okay, look, anxiety has a variety of symptoms, right? So, to mention a few, because there are different types of anxiety, right? And depending on the type of anxiety, your symptoms will vary. Also, people are different. So, that is the reason why, depending on the person, their symptoms will also vary. But speaking broadly about the subject, we could also discuss a storm of catastrophic thoughts, right? That's because it's one of the initial symptoms. Physical symptoms may include sweating, chest pressure, and intense palpitations, where you feel like you're on the brink of a heart attack and your heart won't settle. It can't calm down. Sweating is also a very common, along with trembling, right? Some experience paralysis or numbness, akin to a part of your body or similar to a limb falling asleep. In certain instances, there's dizziness and even fainting, right? There have also been cases where digestive issues arise. Okay, you start with stomach problems, right? Normally, people who suffer from anxiety tend to isolate themselves. They have a very strong mood. That is, they get angry easily, right? So, all this is like a complete range, right? It would be good to analyze it. But generally speaking, those are the ones that I could tell you.
Okay. And I really like that you mentioned the physical problems that anxiety brings, because in the end, the psychological is always connected with the physical. So now that you told us all those triggers, if we identify them, is it easier to face an episode of anxiety? What do you think about that?
Yes, you see, Leah, that is even one of the exercises that I have assigned in therapy when I look at a patient with anxiety, right? Among the recommendations or techniques to combat is to keep a record of all those triggers, because there are different things, right? The symptoms are one thing and the triggers are another, right? Triggers are sometimes more external, so it's important that the person knows themselves and knows what the things alter or will activate their anxiety. It can be a person, it can be a memory, even, right? A physical place, right? Or some specific situation or circumstance. For example, there are cases of anxiety when people feel very enclosed in a place, right? Or even traumatic memories and things like that could trigger anxiety. So it is important to be able to know what specific things trigger your anxiety, and along with that, also the symptoms, right? How to keep that record. Well, for example, I was on the plane and that started to agitate me, right? What did I feel? Well, I started to sweat from my hands. I had tachycardia. Many catastrophic thoughts came, things like that. So it is important to be able to identify them because that takes away power, so to speak, from the episodes of anxiety.
Yes, of course. I have many friends who have suffered those symptoms of anxiety, and sometimes it's very difficult for them to know when it's manageable for them or when it's not. So, when would you say it's important to find a psychologist?
Well, you see, this varies quite a bit. We, as psychologists, handle certain manuals, right, to diagnose anxiety. So, for example, there's a manual called DSM-5. In that manual, we find that symptoms have to appear continuously for more than 6 months in order to categorize it as an anxiety disorder, right? But there are older manuals like the CIE 10, and that one talks about 1 month, right? So I think it depends a lot in the intensity of your symptoms or the afflictions that this is starting to cause in your life, even because it could alter you in your social area, for example, that you no longer want to go to school, right? Or to work,
Yes, I have seen it.
right? Or that you begin to distance yourself and your circle of friends. You start to stop doing things that you used to enjoy a lot. So there we could say that it is the time to consult or ask for help, right? Because it is beginning to alter many things and it's getting out of your control. Here again comes self-knowledge. Being able to know or discern when I can't do this alone anymore, right? So it's time to ask for professional help.
You're absolutely right. And now that I was talking about friends, it occurred to me that I've heard many expressions about being very nervous, but then, oh, I have anxiety. So these two terms are often confused. I don't know if you could explain a little bit about what the difference is between anxiety and being nervous.
Okay, actually, it's not that there is a difference, it's just about intensity, right? It goes by levels of intensity. So it's first, for stars as fear, we could say it's like certain light nerves, right? Then it could be a fear a little more intense or even severe. And after that comes anxiety, right? So it's not that there is a difference, but rather it just goes up in level on a scale.
Certainly. And speaking of these, could you recommend some, well, give us some tips about managing anxiety that people can have day to day?
Yes, of course, gladly. Well, look, I believe there are ways to prevent a problem or an anxiety disorder. Yes. Some guidelines are your sleep hygiene. It's scientifically proven that when you have your sleep cycle altered, it can lead to anxiety problems, right? It's also important to take care of your diet and your physical health with regular exercise, right? Or to be mindful of what you consume because there are certain foods or substances that can trigger anxiety faster
That's true.
because they alter your nervous system, right? So they fill us with dopamine. Sorry, they fill us with adrenaline or even cortisol, right? Which we could say are the special chemicals in the stress right?
Yes, I like what you said about exercise because I feel it's very important when we experience symptoms of anxiety because, as you said, it frees us from a lot of things. At least I have felt freer, and I have also heard experiences that when we exercise and when someone else's exercises, they feel more relaxed. Exactly. And could you share some coping techniques to know what to do when anxiety arises?
Yes, of course. Well, look, there are several techniques, but I had already mentioned some. That is to have that control of what triggers your anxiety and also the control of your symptoms. When you learn to identify these two, you automatically start to combat anxiety. And instead of giving it power, you take it away. Because what will happen in an anxiety crisis? All these physical, psychological symptoms begin to emerge. Um, and if we add this feeling of insecurity, I don't know what's happening to me, I'm going to die.
Yes.
It's the first thing we think, right? I'm having a heart attack.
Yes, yes.
And things like that. So that's only going to increase the problem. It's not solving it. But when you identify what it is, when I'm feeling tachycardia, what happened? I had a confrontation with my boss, with my director, with my teacher, right? With a friend, and that started to trigger my anxiety. So automatically you take control, not the anxiety, but you take it. There are other techniques like, for example, breathing. It's something very common and mentioned, although not many people know how to breathe. Leah, do you know how to breathe, Leah?
I'm trying.
Right now you can breathe.
Yes, of course.
Well, there are techniques or there are theories of good breathing. And it's very important that all of us can learn about them to put them into practice because at any moment we could have an anxiety crisis, right? And so we can practice it. So if you want, let's practice one, shall we?
Yes.
Well, then the first thing for the breathing technique to make it very basic is to try to be in a place where you feel comfortable, right?
Yeah, I'm comfortable right now.
So the second step would be to try to make the environment more calming. Ideally, you will look for a track or a song that is relaxing. Sounds like rain, nature help a lot. Then you make sure you are well seated, right? Because posture is important. And you can close your eyes. We usually close our eyes because it helps us maintain concentration. Yes, right? And then we can practice diaphragmatic breathing. There are various authors who have taught about this breathing, but the most basic it's called 4-6-8. And it means that you had to inhale for 4 seconds, then hold for 6, and exhale for 8. It's not so easy because we normally breathe very quickly. We are used to that, right? But if you want, let's practice it once. Ideally, you put your right hand here on the chest and the other on the mouth of the stomach. Okay, and then we're going to inhale for 4. You can inhale and I count. 1, 2, 3, 4. Hold for 6, 3, 4, 5, 6, and exhale in 8. 2, 3, 4, 5, 6, 7, 8.
Whoa, it is so difficult.
It's difficult.
It's something that I hardly do.
Yes, and it's usually because we breathe a lot with the lung. I mean, here with the chest mostly, and not so much with the diaphragm. The diaphragm is down here, right? So to know that you are breathing well, your diaphragm, your stomach should inflate, not your chest, right? And that's how you're going to make this technique work.
Yes, this is super important because we think that breathing well, it's not going to help us much. And normally, well, we think that we're agitated or something like that. And no, the last thing we think about is calming down and breathing. And I also like what you were mentioning before about knowing how to identify when we are having anxiety or we're agitated or something like that. Because many times we take it for granted. I mean, we don't take it seriously if it were really a problem.
We don't listen to our body.
Exactly. So I think what we learned today in this episode is very important. Thank you so much for coming, for taking the time.
I would like to share a phrase that I really liked that I heard from a psychiatrist. Her name is Maria Rojas Estape, and she has many books on this, right? About being able to have a better quality of life at a psychological and emotional level. And then she said, fear is inevitable, but suffering is optional, right? It just depends on how you manage your emotions. And I really liked it, because there are things we can't control. Our emotions are part of that, right? Because everything around us, well, we can't control it, and they are stimuli, right? That will alter us in one way or another. So many times we are going to feel fear, Leah, in many situations, right? But suffering is optional. If you learn to manage your emotions, and as I was saying, right, listening to your body is very important. Many times when we start to feel something that it's not pleasant, we want to flee or we want to remove the attention from that, right? And that's not the correct way. The best thing is to be able to listen to what's happening to me. Why am I feeling this, right? And let it flow, right? Let it out so that it can pass more quickly.
Yes, how important these topics are, really. It's something not everyone knows. That maybe they have heard the word, but as I was saying earlier, it's something they confuse with nerves. Natalie, would you like to share anything else about the topic of anxiety that we may have missed?
Yes, I always try to teach my patients the correct order of how our body functions, so to speak, right? So I always teach them that everything starts here, right? And from here it goes there, and from there to action, right? So thought first, then emotion, and therefore behavior. It's very important that we take care of what we are thinking. Yes, right? The internal dialogue that one has with oneself, does it contribute or not with oneself? Instead of helping you, many times it harms you more, right? So if you are being very hard on yourself, it's very likely that you have more chances of having some problem or psychological crisis, right? So it's very important that you take care of what's inside here, what comes in, because from that will come the emotion, the feeling, and therefore the behavior or conduct.
Of course, and how important it is to think about obsessive thoughts as well, because it is what we show. As you said, if we have obsessive thoughts, that doesn't allow us to think about other things or express other things, and it even affects the things what that we do day to day. Because if, for example, we're going to school like my friends or to work or something like that, things are not going to turn out all right, or we're not going to be completely calm if we have this obsessive thoughts, right?
Yes, life is difficult, yeah, and if we add obsessive, catastrophic, and negative thoughts to that, imagine for us, we're going to explode, right? So this part about thoughts is very important.
Yeah, super important, Natalie. Thank you so much. I feel that it's super important, right? To learn again about this anxiety. They take it very lightly. And, well, thank you for coming. I hope you enjoy this episode as much as I did talking here with Natalie. Thank you so much for watching us, and see you in another episode. Thank you.